follow-up post for interstitial cystitis or painful bladder syndrome. First of all, I always confirm there's not a urinary tract infection, and yes, I do PCR cultures. Why? Because the results come back quicker and it's using better technology to detect lower levels of bacteria. It's more accurate. We're using DNA to detect those bacteria. So yes, I do PCR cultures. If a patient is experiencing the symptoms of a urinary tract infection, or they have bloating, lower abdominal pain, they constantly feel a general awareness of her bladder, and the PCR culture comes back negative, then I do treat them as an interstitial cystitis patient. And the first thing we do is eliminate bladder irritants. Anything with acidity, lemons, limes, oranges, tomatoes, vinegar, spicy foods, alcohol, carbonated beverages, caffeine, all those things gotta go. I provide a list of bladder irritants, and then I also usually give something for them to take as needed on a particularly bad day. So unless they're going to use over-the-counter Azo, I prescribe something like Urabel, Urogesic Blue, Uro MP. Those all turn your urine blue, by the way, so you pee like a Smurf. So that's the regimen usually for the first 4 weeks after diagnosis. Watch bladder irritants and use an on-demand medication, something to help soothe your symptoms. When that doesn't work, I move on to some medications that are off-label, not FDA approved for painful bladder syndrome. However, I have found good results with these medications, so I do prescribe them. Number one, hydroxyzine. It's an antihistamine. You take it at night before bed. It makes you drowsy. It helps your bladder pain, I promise. If that doesn't work, I usually move to amitriptyline in a lower dose, Elavil. It's an antidepressant, but it's also been shown to help with pelvic pain and interstitial cystitis. And then my last go-to is something called cimetidine. It's a GI drug. It helps with reflux. It's also been shown to help with the bladder. That's not my first line because you have to remember to take it twice a day. There was a drug called Elmaron that we used in the past, but people have retinal issues with this, and I have totally stopped using it. So that's my algorithm before procedures. Let me know if you have any comments or questions.